presentation of 9 on Your Side's Independence, a WNCT Roundtable on Addiction, is brought to you commercial-free by Integrated Family Services.
Addiction. Credible studies show half of us in North Carolina experience it, yet few of us have the courage to actually talk about it, because if we did, we'd have to admit we have a problem, or at the least are helping somebody keep their problem a secret. I feel like I might be talking to you there. Thanks for inviting us in tonight. I'm Jeff Varner. For the next half hour, I want you to listen and watch, because at the end of this thing, I have a question for you, and I want you to be able to answer it honestly, all right? Will you make that deal with me? Give me 30 minutes. It may just change a life for the better, and who knows, perhaps it'll be yours. Now, before we get too deep, let's get a little deep, shall we? Off the top, I want you to know someone whose story inspires me every day. A walking, breathing example of no matter how bad it gets, you can win.
It says redemption, and there's actually a chain which was to me the bondage of addiction, and now the cuffs are open, so I feel like I've been unburdened by the addiction that I suffered from, and I'm trying to redeem myself. I was born and raised in Spanish Harlem. I chose to leave my house at 15, so what do? I start selling drugs. And my curse was that I was pretty good at it. And I've done all types of drugs, anything from alcohol to angel dust, crack cocaine, hallucinogens, whatever was out there, I did. My addiction took me to some really dark places. At one point in time, I was homeless, and I'm sitting on a park bench by myself. And New York has some cold, brutal winters. They're unforgiving. I knew it was time for a change, that I couldn't go on like that. I moved here to North Carolina. It turned out you can run away from your environment, but you can't run away from yourself. An addict is an addict. The next thing I know, I'm back on some hard drugs, doing the same thing I was doing in New York. And here, I didn't even really know anyone. So now the addicts became my friend. I was in and out of jail. Finally, a glimmer of hope came into my life in '97. I met who is now my wife. I come home one day, and this was after, using probably 2-3 days in a row, and my wife, my angel, was sitting at home circling apartments. And I come in, I'm like, baby, please don't leave me, I'm gonna change. And these aren't for me, these are for you, you're getting out.
Why is he your man?
I'm still trying to figure that out.
I had to make a choice. And I told her for the 1,470th time that I was gonna do well. I was gonna try my best. And I knew I didn't get sick in one day, that I wouldn't get well in one day.
You've been clean how long?
Well, I've been clean now for 8 years. There's a difference between being clean and sober. I could throw you in a cell for 10 years. You're clean, but you're not sober if you haven't done any work, any programs, anything to get coping skills or knowledge of what your disease is, because it is a disease. No one can just put this down and walk away, or everyone would do that. I believe that addiction is a brain disease, and it is a genetic thing. For one, I don't know anyone in their right mind that would want to live the way a full-blown addict does. I put together a program that worked for me. Each person is different, and they should have a program. I have a criminal record because of addiction, but guess what? I'm not going to let that hold me back.
Don't give up on them. Just encourage them to get help, but just don't ever give up hope on them, because there's a better person inside just waiting to come out.
I'm not a junkie. I'm a college graduate. I'm a father. I'm a husband. I'm a good person, I feel. And I'm trying my best to enlighten the community that I so selfishly took from in my active addiction. I'm trying to redeem myself now by doing these things. And if I could save one person or help one person on their journey, then it was all well worth it.
What a fascinating story there. We barely touched this guy's story here. He teaches us all we don't really know addiction like we think we do. It's not an irresponsible person simply drinking and drugging for fun. Addiction, it's really ugly, yet few people understand what it means and the power we have to actually change it. Our goal here is to not only inform you about the problem, but to empower you with information. After all, change does start at the kitchen table, doesn't it? We're about to dig into addiction through the eyes of more than a century of experience. We assembled a panel of experts at Greenville's Magnolia Arts Center Theater, where these life changers started us off at the logical place to begin by answering the question, what is addiction? what is addiction?
Well, I think the simplest definition of addiction is that it's a compulsive use of an addicting substance, of a substance that you become dependent on, despite the fact that you have continued adverse consequences. Bad things happen in your life as a result of using.
When we hear the word addiction, oftentimes I think the layman's way of looking at it is it's chronic use. So, you know, Johnny goes home every day from work, gets a six-pack of beer, he drinks that six-pack, he probably has an addiction.
And so if they don't, they then begin to use the drugs just to feel normal. So I think the transition from recreational use of drugs to addictive use of drugs is when you stop getting high and you start to have to use the drugs to be able to function normally.
If you keep getting DWIs, if you keep losing jobs, if your family keeps having, blowing up at home, if you keep having conflicts at work, if you continue that, then you probably, and you're continuing to use, then you probably got some issues you need to deal with.
When people get into end-stage addiction, nothing matters but the drug. Nothing else matters but the drug. The wife doesn't matter, the family doesn't matter, the household doesn't matter, the job doesn't matter. Nothing matters but the drug.
One important aspect of addictions that we've learned in the last decade is how addictive substances change the brain. All addictive substances seem to have the same effect on the brain.
Actually, it's more the limbic system, the middle part of the brain, the part of the brain that deals with pleasure and that deals with survival and deals with emotions. It's not a thinking issue, it actually is a chronic disease, and we really need to get rid of the concept notion of it and call it a chronic disease as we do with cancer, diabetes, asthma, and the such.
Let's talk a little bit about behaviors, because it's not just a substance, it's not just heroin, it's not just cocaine, it's also gambling, it's sex, it's social media, the internet, people can't get off porn, whatever. How does that differ from the substance, and do we approach it the same way or differently?
A lot of what we call behavioral addictions are now showing to have those same neurobiological changes in the brain that we see with substances of abuse. So the addiction part of it is genuine, and for the most part, our treatment is very similar.
I agree.
Well, that was easy.
But I don't think that a lot of people know that there is a such thing as behavioral addictions. I think when we say addictions, the first thing that we think of is substance use. It is the drugs, it's the alcohol, the heroin, or the cocaine. We don't realize that people can be addicted to sex, to shopping, to Facebook.
Tanning.
To tanning, yes.
Because it's the release of the dopamine, it's the release of the various chemicals in that reward center. So yeah, we think of, and usually illicit drugs too.
I went to my dentist about a month ago, and my dentist was sharing with me one of their patients that comes in and gets their teeth whitened, and they do it habitually. And they've done it so much that it's beginning to wear away the enamel on the tooth.
Addiction, a disease or a choice? You smiled when I asked that question.
No one sets out with a desire to develop diabetes. No one sets out with a desire to have a heart disease. Because of lifestyle and choices and genetics, what we choose to put in our bodies, and it is a disease.
Even in that answer, you used the word choice twice. So do we make the choice and then the brain kicks in, or does the brain tell us to make the choice?
The simple answer is it's both a choice and a disease or disorder. And everybody has a genetic vulnerability, and there are clearly differences in terms of genetic vulnerability. The big choice is, are they going to come to treatment and participate in treatment or not? That's where the choice really kicks in. Because if you have a disorder, my view is you have a responsibility to take care of it, right?
Panel making some very good points there about those behavioral addictions. You know, when we talk those, gambling, internet, Overeating, sex, shopping, tanning. We know somebody who's experiencing that. Addiction is not just about drinking, smoking, and drugs. All those activities, like the substances, have much of the same characteristics. Now, like substance abuse, they cost not only the addict, but their families and their loved ones, basically society as a whole. Treatment alone can curb those costs. For example, let's take a heroin addiction. To turn one of those around with a methadone maintenance program costs somewhere in the neighborhood of about, I don't know, $5,000 a year. That's a lot of money for most folks. But compare that to treating the addict the way our society often does, by throwing them in jail for a year on a possession charge. That costs minimum $24,000 a year, a lot more money. To find these types of savings, the ones that motivate change, if you will, we have to first take a look at what the addiction actually costs.
Recently, the plant manager of Bridgestone Firestone that makes tires is the largest employer in Wilson County. He told us that on any given day they may have 40 vacant positions that they cannot fill because applicants can't pass a pre-employment test, drug test. Sam's Club in Rocky Mount, when they opened, they had 4,000 applicants for 160 positions. 2,000 did not pass the initial screening, and by the time they did pre-employment drug screening on the remaining 2,000, Sam's Club in Rocky Mount had difficulty filling 164 positions out of 4,000 applications. If you talk to temporary agencies, they're experiencing the same thing. So let's start with economic impact, just straight out.
If mom and dad are using alcohol, smoking, marijuana, that type of thing, then the child has access and has early access. Kids are lost through courts and stuff because of substances. And that's really one of the #1 things that we see in this area in terms of how kids end up in the system, in terms of being lost custody because of parents that are using substances.
So what if you could magically remove alcohol and drugs out of Pitt County? What would happen to your juvenile court dockets? What would happen to your superior court documents? What would happen to the inmates that are in the jail cells right now? If you want to think about economic impact, think about what would happen if you could just magically remove, and how much would be saved within any given county.
The magic wand would be wonderful because, yes, the money that would be saved, but would the person, if we do think of addiction as being a chronic illness, would the person then find a behavioral addiction? Would they find something else?
And it's hard with policymakers because what are they going to fund? A new bridge and a new highway and concrete and pavement, or are they going to fund a new treatment program or prevention services? So we're always competing for bricks and mortar and infrastructure and all the other things.
And how many of our lawmakers are going home and downing a bottle of wine every night because they have to, you know what I mean?
Or have family members
right.
that do.
The key word to me I hear is accountability. That all of us should have accountability. Accountability for our actions, for what we want to do, what are we doing, what we desire to do.
It usually starts very early on in life, and if you can identify it and start working with it at that point, you can sometimes prevent somebody from becoming 40 years old and drinking a half a gallon of Jack Daniels every day.
I agree with both of those points. It's very important to recognize it as a chronic disorder, and very much like many of the other lifestyle disorders that cost us so much personally and economically.
Now, the costs associated with addiction don't always fit nicely into a spreadsheet or a calculator. Addicts do a lot of damage, not only to themselves, but to those who love them, including their children, who they are teaching to do and be the same. An addict's collateral damage is often the disease's most debilitating cost. Let's talk about that collateral damage. when you do have an addict in a house, how does that ripple?
It's a family illness, and so I think that that's that big piece. So there's probably a primary enabler. There's someone who, even though they hate it, they're still enabling it in one way or another. The children, they're learning behavior. So is it nature versus nurture? But again, we stigmatize it, so it stays that secret. Secrets keep us stuck, and we don't address it. It's very shameful, and so it just feeds that addiction and the family dynamics of it. So there's absolutely a huge rippling effect.
So we have this concept in addiction called codependency, where the family sort of organizes itself around the defect that the addict has. So if the addict goes out and gets fight and ends up in a bar, families immobilized, they're always sort of ready to go out and pick them up and bring them home. And then they're furious at them the next day. And all of this is part of a pattern that ends up to be very dysfunctional.
How do you deal with that? There's a woman watching right now who thinks her husband's addicted to something and doesn't know quite what to do.
They should go to one of the support groups, I think, Al-Anon, Alateen. There are many, many out there, and they can share with them their experience of what's worked. And generally they'll find out that what they're doing is really not the best for them or for the person who's suffering with the addiction.
It's amazing how many resources we now have as a result of the internet, but when we're stuck in that pattern of codependency or shame or enabling, that we don't seek help, just like the person who struggles with addiction doesn't always seek help.
And I would say to that the person, again, ask. Start talking, get the information, start talking to somebody. And I think we'd also want to offer hope. There is nothing, when you talk about family addiction, there's nothing more rewarding for us than to work with a family and see them put it back together. It is treatable.
Recovery is possible.
So we're really trying to put a face, and we're really asking people to be willing to stand up and say, this is my story, and it's ending well, and I want you to know about it.
And that is a very tough thing to get people to do. Most in addiction get mad when you bring it up. They'd rather you not talk about it. This truly is the family's dirty little secret, and one we as a society perpetuate with our own behavior. We blame them. We accuse them. We treat people who are addicted like they're lazy and immoral and they could just easily stop. Our fear and misunderstanding, as with most things that makes us uncomfortable, causes us to act out. It's our behavior that ultimately pushes the addict deeper into the dark.
If there is stigma, if people look negatively on having addiction, the person themselves begins to want to hide the addiction.
I think it's really important. Addiction is a secretive disease. It's a family secret.
In rural eastern North Carolina, there are but so many substance abuse facilities or providers who provide substance abuse treatment. In this area also, everybody knows everybody.
Of course, we put this huge sign that this is an alcohol and substance abuse treatment center. So everybody that comes in there is identified that way. So it's very taboo to seek treatment, to see a psychiatrist, to go for alcohol, substance abuse treatment. And God forbid anybody think anybody's crazy.
If someone has diabetes, which the numbers are pretty high for that, we'll celebrate them seeking treatment. Oh, get treatment, great, what can I do to help? The whole family will change their diet. If someone needs treatment for addiction, though, we don't celebrate it. We get angry at them because, well, you're just not trying hard enough.
Now it's becoming more foremost, and some even are stepping up and stepping out and saying, you know, I have this problem and I need treatment, and I need more than just believe in a way. I need more than just to have faith. You know, I need some information, I need some knowledge, I need some clinical attention to me.
Many leaders in healthcare believe that addiction is the biggest public health problem we have in this country, and growing. And it's under-recognized within the medical care system, and there's not sufficient resources directed at prevention or treatment or identifying high-risk situations.
Why not?
Probably the same reason that we talked about, the stigma, the fact that some people would rather see it as bad behavior rather than a disorder.
We've been working more over the last few years to put a face on recovery. We've been working more to have people who are willing to step out and say, you know, I was an addict.
But as we're talking about stigma, isn't it difficult to stand up and say, I am Jeff, I am an alcoholic, I am an addict? Like, doesn't that feed the stigma in a way?
It certainly can, but I think that that's where, again, empowering the folks that we work with, and then also hopefully empowering the community, is that you're Jeff. You happen to have struggled with an addiction. You're now in recovery. The stigmas are breaking because we are putting a new face on recovery rather than it being the shameful, secretive thing that, well, no, I just can't drink. Well, why not? Well, I'm in recovery. So rather than being ashamed about it, being proud about it, having that moral courage to do what's right.
How do we get our policymakers to open their eyes?
One way is by celebrity statements. You know, we had a big cocaine epidemic in the 80s. It turned around when Len Bias died from cocaine overdose, right? University of Maryland basketball player.
You have a gold medalist who wins 14 gold medals. His picture is on the front of all the papers, and then 3 months later he's on the cover holding a bong. So celebrities don't do us a lot of favors sometimes.
Open up to begin to look at the person that's drinking and drugging just a little bit differently. And then that's when you start seeing a change in attitude, a change in policy, and a change of the way that we're looking at the person that's abusing substances also.
Yeah, people can be pretty mean. And mean people, I'd like to say, raise mean children. And it's that name calling that we need to stop. You know, earlier in the show, you met Martin Maurer, all too familiar with the meanest aspect of this disease. He and his wife, Cara, are joining me live tonight in the studio. I'm glad you guys are here. Talk about that stigma. How true is all of that? How did stigma get in your way to recovery?
Well, to me, it was like stigma, the first word that comes to mind is negative.
Yeah.
I think people have an idea of what an addict does all day, what an addict looks like,
right,
what kind of family an addict comes from.
Right.
And these things are just simply not true. So when you come forward, you feel like that judgment of negativity is going to be on you.
People are afraid you're going to steal.
Right.
Break into their house, they don't want you around.
Yeah, I mean, and unfortunately, once you're addicted, things like that may happen. But when you're trying to get well, that's a totally different situation. So I think society should just accept the fact that this person has a brain disease. They're trying to get well and not judge them. I think the stigma has a lot to do with the negativity and the judgment.
We are a society who judges. We definitely do, and it's an awful thing we need to change. Talk about denial. I know when I talk to a lot of people who may or may not be in an addiction, they get so angry. Yeah. I don't have this problem. They're not talking about me.
Well, one of the things that comes to mind for that is the truth hurts. You know, a lot of times when you say something like that, a person will deny it because then they have to do something about it. Yeah. And most addicts are scared to go into recovery. It's a scary thing. If all you know is addiction, when you ask them to do something different, it's a scary situation if you don't know.
Don't they know, though, they can be better and feel better and change their life?
Yeah, knowing it and doing it is two different things. And, you know, I'd just like to say to the family members, denial, don't love your loved one to death, because you can do that by denying little Johnny's all messed up because you don't want the family to look bad. Right. Say something so that that person can live. Denial it could be a deadly thing.
That is such a great point. Cara, how many times did he say, I'm changing, and he didn't?
More times than there are.
Why'd you stick with him?
I could see the turmoil and the pain. Nobody wants to live like that. Yeah. And it's a sickness. Yeah. And people don't understand. Like he said, they want to judge and want to see the negative, but nobody wants to live that way. I could see the pain. And so I began to educate myself so I could understand what he was going through. I think education's the best thing, and then that way I was able to figure out a way to help him too.
So families at home need to do some digging, find out some information on their own.
I mean, get on the internet, go to the library, anything you can do to help understand, because
you, Martin, are turning things around. You've got an effort that you're doing, Redemption 180. We have more on that on our website that we'll point you to, WNCT.com. Yes. But right now, you got just like 10 seconds. Okay. Final message to people.
Just
real quick.
Addiction is a disease. It is a brain disease. So please, if you can, try to help someone. Tell somebody your secrets.
There you go. Let them know it. All right. Well, like Martin, each member of our panel had their own hopes for you. We wrap with what they hope you leave us with.
It is a chronic illness, and rather than it being stigmatized, we need to work better as individuals, communities, a nation, of actually looking at it as a chronic illness and treating it as such, and starting to break down those stigmas.
That it usually starts very early on in life, and if you can identify it and start working with it at that point, you can sometimes prevent somebody from becoming 40 years old and drinking a half a gallon of Jack Daniels every day.
It's very important to recognize it as a chronic disorder. And very much like many of the other lifestyle disorders that cost us so much personally and economically.
Treatment exists, treatment is there. There is so much more education about addiction, substances, behaviorals than there ever has been before.
Prevention works, and it begins at the kitchen table. And I really believe that it's a mom and pop operation. Moms and dads need a lot of supports.
There are people who care, people who do love. There are people who do want you to be successful. There is hope, and there's hope from an addiction, a pull, something that's getting you away from where you want to be. You can find it.
Because help is absolutely out there, recovery is possible, and people care. Now that question I promised you at the top of the show. Anything you hear here resonate? Think you or someone you love may have a problem? You only know your truth. This show and the numbers you can call for help are on our website. Please share it with everybody. Have the courage to use it to help yourself or someone else, because help is out there. I'm Jeff Varner. Until next time, thanks for inviting us in. Go do something good for somebody.
I think it's a wonderful thing. I'm glad we did it.
I hope that they are also able to learn a lot about addictions.
It was really interesting to be up there with very knowledgeable and resourceful colleagues, and to just see how much we're really on the same page.
I think we should be acting on what we already know, make changes on what we have reasonable certainty about.
It was very good to get a lot of different opinions and get a diversity of opinions.
It's really a privilege to be a part of this panel tonight. I really appreciate the station exploring addiction.
This presentation of Independence, the WNCT Roundtable on Addiction, was brought to you commercial-free by Integrated Family Services, a premier behavioral health agency.